Oh, it looks like we are live. So, hi everyone. Thank you for coming to the last day of our healthcare sneak peek week. And today we are here with Lori Nesselrode, who is a physical therapist. So, Lori, would you be able to introduce yourself and maybe give a little bit of background about how you got to where you are?
Sure. Hi, everyone. My name is Lori Nesselrode. I am a physical therapist at Grant Medical Center. Currently, I am called the Orthopedic Rehab Program Coordinator, although I basically function as a physical therapist on on most days. How I got here is basically when I graduated high school, I thought I wanted to be a special education teacher. I went to a small college, and the summer after my first year in college, I actually worked as a janitor in an elementary school. And I'll never forget this day. I was cleaning a library on a little four-wheeled scooter that I got from the gym teacher's closet. And I just had this epiphany that I needed to change my career path. It's like nothing that's ever happened to me since. It's just, I was sitting in there. It was just me and another janitor cleaning the whole school for the whole summer. And I think having time alone and having time without distraction and just hours and hours of thinking about who I am, who I want to be, what my values are, what passions I have, what makes me happy. I just realized that that's what I needed to do. I was introduced to physical therapy in high school because I had injured my knees, which is a way a lot of people start thinking about a career in physical therapy. And that's my story too. I had gone to the doctor and they sent me to this therapy gym afterwards. And I just saw the spirit of the gym and I saw the physical therapists being helpers and realized that, this is something that's for me. I've always been a helper. So that's been what makes me happy. So I did end up reaching way out of my comfort zone after that first year in college and transferred to Ohio State. And at that time, physical therapy was just a bachelor's degree. So I had to do a lot of work to get transferred into Ohio State. I had to wait a year before I could see whether I had been accepted. I had to do 200 hours of volunteer service, which really kept me hopping. But basically became a physical therapist. My first job was with one of my Ohio State University clinical coordinators who also had a private practice. And so my first job was actually here at Grant Medical Center, who he had contracted with. It wasn't OhioHealth yet. So I worked in nursing homes. I worked at Grant Medical Center with this first job that I had, ended up getting married, worked in Lexington, Kentucky as a staff therapist for about 4 years in a hospital setting again. Came back to Columbus, had kids, and worked again at Grant when it turned OhioHealth for about 4 more years. Transferred and got a promotion actually and went to Riverside. I was there for 16 years. That position was called senior PT in orthopedics. I, like I said, worked there 16 years. 2015 comes, I get pulled into my director's office and I go in the office. Here sits a human services representative. And I'm thinking, what in the world is happening here? And sure enough, my senior PT position became obsolete. So basically, luckily, they didn't just ship me out. They said, you can be a staff therapist again, or you can apply to our new restructuring of our system. And so I had the opportunity to interview to be an ortho program coordinator, which was what I did. It was hard for me to do that after so many years. I had to dust off my resume, dust off my interview skills. My kids are graduating from college at the same time, so we're all like writing resumes, practicing. But I did get the program coordinator job here at Grant, and that's what I've been doing here for 4 years. So that's my
Yeah,
background.
that's awesome. And it sounds like there have been some changes in the requirements, the education requirements. Could you talk about what does a school path look like if our students are thinking about their education? How do you get there?
Okay. And this is where, I work with a lot of younger therapists, and it's changed so much. what happens now is you basically get an undergraduate degree, and it can basically be what it sounds like is in anything, but whatever, you want to make it go towards what you're learning in physical therapy. So that we have a lot of exercise physiology majors, a lot of different things, allied med majors of some sort. So you have to get that undergrad degree first and then apply to PT school. And then your PT school has now become a doctorate of physical therapy. So you're in school for 3 more years before you graduate and can sit for your licensure to be a physical therapist.
Yeah, that's really helpful. And could you tell our students, like, what does a typical day look like for you? And it might be helpful if it's very different from when you were a staff therapist to your job now, to maybe like walk through both.
Okay. And a lot of my job is being a staff therapist. I basically have just 1 day a week where I would just work on the programming of what's behind the scenes and orthopedic care, like our protocols and stuff like that. But for the most part, every day I come into work, I do have a little extra job where I do the scheduling in the morning and that kind of stuff. And I do the rounds with the doctors in the morning. So that's above and beyond what a staff therapist would do. But when I start working with my patients, it's usually right 7:30 in the morning. And my patients are typically on the orthopedic floor anyway. They're total joint patients, total hip replacements, total knee replacements, hip fracture repairs, back surgery, foot surgery, that kind of stuff. Now, if you were talking about a staff therapist in all of maybe Grant Medical Center, we're a trauma 1 facility. So we're seeing all kinds of very, very bad accidents, that kinds of stuff too. And then you've got heart failure, you've got strokes, you've got all kinds of diagnoses around the whole hospital. But my day would look like I come in, I have a list of patients in a 10-hour day, which is what my typical day is. I can probably see about 10 patients, a patient an hour. And I will just say, for instance, my first patient is a hip fracture patient. So I go in and I usually see them the day after their surgery. So I'll be the first one that gets them moving and out of bed. So I go in and see that patient. I usually ask them first, what have you been able to do? Say it's an 85-year-old lady that fell and broke her hip, but she was living independently, no device. And now she's lying in a hospital bed, basically 1 leg down, maybe not allowed to put weight on that leg for 8 weeks. So I have to teach an 85-year-old lady how can she function now. And so I basically help her get out of the bed for the first time, teach her how to sit on the edge of the bed, teach her how to stand at a walker, and teach her how to walk with a walker, even not putting weight on that leg. Maybe she has stairs at home and she wants to go straight home. She has a daughter that stays with her and can help her at home. I have to teach her and her family how to manage everything, how to get into the house, how to get in and out of the bathtub, how to get up and down from the commode, that type of stuff. So my job is very focused, but really it's really holistic as far as working with the rest of the team, the nursing staff, the case manager, the social worker. Maybe this lady can't go home. Maybe she lives alone, doesn't have family close by. So then I have to coordinate with the social worker that she can go to a nursing facility to get therapy before going home. And then there's the documentation part. After I see this patient, I've got to document, and I've got to prove to the insurance company that this lady needs her insurance covered to pay for the rehab facility. So it goes pretty deep. But every patient that I see, there's, you see the patient, you establish where they are functionally at the point in time, and then you set up a treatment plan to get them on their way so that they can function and go to their next step after the hospital. I set goals for them, and I set goals for their caregivers, maybe to educate them. And then from that point on, I either continue to see that patient, or I can pass that patient off to a physical therapist assistant to see the patient for the rest of their time in the hospital. Does that help?
Yeah, absolutely. And that was actually perfect, because one of the questions that just came in from Facebook is, do you recommend going for your physical therapy assistant license? And let's see, it says, if not, what experience would you recommend to make sure you stand out in a good way when you're applying to the doctorate programs, or maybe even like your first job?
Okay. Well, the first question about being a physical therapist assistant, it's a great option. There's a lot of things to consider. A lot of times the younger therapists that are having to get their doctorates, they come out with so much debt. If you don't have the resources, and if you if you want a physical therapy degree and you're willing to have maybe some debt the first few years or the first 20 years or whatever it takes to pay off your school, it's being a physical therapist is worth it. But if you really want to start your career, make a decent salary, maybe not a ton of money, but the difference between a PTA and a PT probably financially this is just a guess, but I would say as a physical therapist assistant, as far as financially, you will probably make one half, maybe to 2/3 less, maybe even say one half. So you won't have the opportunities to move up being a physical therapist assistant. But if your true love is seeing patients and caring for patients and being that helper, a physical therapist assistant is a perfect job.
Absolutely. And that's a theme that we've been hearing from all of our professionals this week is to, seek out opportunities where you can try to gain as much experience as you can. So that could be a really helpful path for the students that do want to kind of jump right in.
Right.
Someone
You asked about being a staff, how to progress.
Yeah.
As far as getting into PT school and stuff. I think a lot of what the schools are looking for is that experience. So try to get some experience in a hospital, whether it's being a personal, like a nurse assistant type job, PSA, personal care assistant, any type where you're getting hands-on experience with patients or clients of some sort, whether it's pediatrics or whatever. I'm very hospital centered. So when you hear me talking about that, that's just because that's what I know. But if you're interested in pediatrics or something like that, or outpatient, certainly get your hands in on that. But getting as much experience is really helpful for one thing, because that'll help you know whether this is something you really want or not.
Absolutely. And yeah, those are all great tips. And even being something like a PSA or a PCA, depending on what hospital you work at.
STA is
yes.
Yes.
That really allows you to get to see the work that's being done, and so that exposure, even if you're not actually doing physical therapy right away, can be really helpful, like you said, in deciding, yes, I really want to do this, or this is not what I thought it was like.
Right.
Maybe I want to try something else. And so, someone else asked, what would you say, how much of your job would you say is documentation and paperwork as opposed to like hands-on with the patients?
Right. That's big. And when I ask people, like, what is your least favorite part about the therapy job? It is documentation oftentimes. I mean, we really a lot of people go into this really wanting the patient care, but I will say sometimes it's almost half your time is spent in documentation, and it's not always the case. Being a physical therapist assistant, it's a little less time documenting because you're not establishing that plan and the goals. You just follow the plan and the goals that the therapist has set up. But it depends on what setting you're working in. In acute care, you spend a lot of time documenting, which sometimes it's not all bad. At my age, I like to sit down and document a little bit because it gives me a break, because my body's weighing down after 30 years of doing therapy. But in general, documentation is something that most people don't like being a therapist, but it's something that's necessary.
Absolutely. Someone wants to know, what would you say is the most rewarding part of your job, and what would you say is the most challenging?
The most rewarding, of course, is working with people. I mean, people, it's just amazing. You hear all kinds of things working with people, and it's not just the patients, it's your coworkers too. You can see somebody after surgery, and they get up for the first time and their whole body mechanics has changed because now their hips not sunken into their pelvis, or their knees not completely bowed out, and they're so happy. And it's just rewarding to get to see them functioning better every day, out of pain, out of the cycle of misery that they've been in. And even with somebody that's had an accident, I've seen people that have had a car accident, and they're so grateful that you're there to get them moving again and get them back to their life. As an outpatient physical therapist, you would see the same kind of stuff. You see somebody coming in that can barely lie on the mat to to do their exercises. And then you're able to be a big part of their care to make them function again. But yeah, that's the most rewarding is just working along somebody in their journey. And it's usually a bad part of time in their life. It's maybe the worst time in their life. And you're there to support them and be a part of the team that helps them get better.
Yeah, and I feel like, it must be really hard for the patients because they are kind of relearning or readjusting to things that we take for granted a lot, just basic kinds of things. And so is that what you would say is the most challenging? What kinds of things, do you find that are maybe kind of hard on the job?
Yes. I've thought about this because I knew this question was coming. I think for me, some of the challenges are not necessarily there's some challenges when people don't want to move with you and they're depressed and they refuse your care and that kind of stuff. But that I took personally early on in my career, but that's just one thing where you can't take personally. It's not you. It's, it's a part of the job. It's part of who what they're dealing with right now. And one of the hard things about my job is I don't have anybody else living at my house right now that understands healthcare. And so I go home and I'm drained, and not having somebody, I have to transition. Before COVID happened, I would go to the gym before I would go home because I needed just time to de-escalate, to debrief on my own and just transition to home to my regular normal life. People don't understand the stuff that you deal with as a therapist, as a nurse, or anything in a hospital unless they're actually there with you. So that's one of the biggest challenges for me and has been for years, is just understanding that. As far as working in the hospital, other things that may be challenging is, let me think. I want to say, I don't want to say politics of the hospital, but sometimes it is. Like sometimes you really want to do more than you can for a patient because you don't have the time. You've got to move on. You've got 12 patients on your list. You can only get to 8 of them for that day if you're working an 8-hour day. And that's what's frustrating, is you can't always do everything you want to do to help somebody. And that's, sometimes we're short staffed. There's a lot of things that happen, and it happens in every job, but there's certainly challenges that way.
That's been a theme that we have been hearing this week as well, is like, have your network of people, you have your, outlets for self-care for sure. The next question that just came in, how does occupational therapy and physical therapy, how do they differ in their practice? Do you work with occupational therapists?
I do. Both, we're very, very close. What we do in the hospital is very, very similar. When patients ask us this question, I basically tell them, especially in the orthopedic setting, is I tell them, the physical therapist, we're going to work on the gross motor. We're going to work on your bed mobility, your transferring, your walking up and down the hallway with a normalized gait pattern. We're going to help you do the stairs. We're going to teach you exercises. The occupational therapist deals more with your activities of daily living, like getting up and down from the commode, getting in out of the a bathtub or the shower, dressing. That's a big thing for our hip patients. For instance, they have precautions where they're not allowed to bend over for a while. And if they do, their hip could dislocate while it's healing. So these occupational therapists will go in and they'll teach them those hip precautions and how to dress and bathe and do the kind of things they need to do without that hip dislocating, basically. So there's a lot of overlap in the PT and OT in the hospital setting. You can specialize in a lot of different things. For instance, in occupational therapy, as an outpatient, a lot of occupational therapists could specialize in hands. You see that both in OT and PT, but you a lot of times it tends to be more of an occupational therapist that will do that. Here at Grant, the occupational therapist does most of the shoulder care. So if they've had a total shoulder replacement, it's the occupational therapist that sees them. Every hospital is going to divide it up a little bit differently, but we work hand in hand, and every hospital, like I said, will divvy up the duties. Sometimes what we'll do is an occupational therapist will see a patient one day and then the physical therapist will see him the next day. So a lot of overlap, but there are definitely differences in the treatment plan and the goals that we set for these patients. So we look at different things.
Yeah, that makes a lot of sense. And it sounds like you work pretty well as a team with all of the OTs.
We do
Um,
very closely. Yeah.
that's awesome. Um, Next question is, what are some skills that you think help make someone a good physical therapist?
Definitely having a personality where you love people, you accept people, you accept them for who they are. Every every person has dignity. Every person has worth. A lot of soft skills, a lot of being able to be adaptable, be personable, I mean, you got to be tough too, because a lot of these people just, not a lot, but a lot of patients, especially if they didn't expect to be in the hospital, you really have to be an encourager, a coach, a facilitator to encourage them to do what you want them to do. So, yeah, and you do have to have a lot of skills. You've got to, when you go through school, you can't just learn to take the test. You've got to learn to be able to apply the skills, which is one thing I wish I would have done better as I went through PT school. I was one that didn't have a lot of experience with patients before I went to school, and we didn't have the internet or anything either. So I saw patients, say, with Huntington's chorea, which is a disease. Today, you can Google that and look at a YouTube video to see what that looks like. So I think now, I looking back, I would have for sure had some patient experience before I went to school, because then when you're learning, you say, yeah, I've seen that before. I've seen that patient with Huntington's chorea before, or something like that. I went off track. I forget even the question.
No, no, that's really
The
helpful. Like what
skills.
skills? Yes.
Yeah, skills. So yeah, make sure you've got to really be good with people. I think that's the main
Yeah,
thing.
that's yeah, that's really important. It sounds like, just like you said, you're kind of talking to them on a bad day potentially,
Right.
and being able to build those relationships as well. Um, I think there was a question that came in that asked, what school did you go to? And I think you mentioned that earlier. You went to Ohio State, correct?
I went to Ohio State. Mm-hmm.
Perfect. Um, and we kind of touched on this a little bit in the last answer, but is there anything that you would recommend? Our students are working on their associate degrees. They're kind of just getting started. And then likely, if they're interested in this career, planning to transfer and continue their education. Is there anything that you might recommend that they could be doing right now that could help them maybe build their resume?
Um, Once again, it's getting the experience, and that's really gonna, because I think in physical therapy, there's a lot of things you don't see that we do every day. We have to wipe people's butts. I mean, we have to do a lot of stuff that you don't think about a physical therapist having to do. And a lot of times people think about going into physical therapy thinking they're going to be in an outpatient setting where they're doing like sports medicine and that kind of stuff. A lot of people don't end up doing that thinking they're going to. Some people, one of the therapists that I work with, went into physical therapy thinking she was going to be on the Buckeye sideline, doing physical therapy, and that she's an acute care therapist that is in the nitty gritty of the ICU every day. So as far as the things to prepare for is just, for one thing, do a lot of shadowing and just make sure this is the right career field for you. And especially if you're going to have student loans and that kind of stuff, once you get started in it and you're already in your career, it's hard to change and get out of it, because you're already kind of financially invested to do that. Um, other things to do is, to get into therapy schools, it's very competitive, so you've got to keep your grades up. Find mentors, do a lot of networking, having and show interest in schools. Like, maybe if you're interested in physical therapy and they know what schools you're going to apply to, just show interest. Call maybe one of the directors and say, hey, I'm really interested in this. Just have your name out there to some of those schools. It's never a bad thing to do that. Send a couple emails, and then they know your name. At least when you apply to these schools, they say, oh yes, this person, I remember they were very interested in our program. So that is always helpful.
Yeah. And we have lots of education type questions coming in, and
Okay.
someone wants to know, did you get into your program the first time you applied?
I did. It was
Yeah.
very different back then, but I did. I think when I applied, like I said, it was just a bachelor's degree. There were 70 positions and there were over 300 applicants. I did go in with I had a 4.0 because I was just that kind of student. But like I said, that 4.0 got me into school. But once I got into school, I didn't do this as well as I should have. I should have switched gears and really thought, I've got to learn now to be able to treat patients well.
Mhm.
So it's very important to have those excellent top grades to get into the programs. But then once you do, really, you don't have to get A pluses on every test. Just know what you need to know to be able to be in patient care later on in life. Um, as far as what was the rest of that question?
Um, the next question actually is a little bit of a shift kind of from applying to programs. And could you tell our students like what's necessary to maintain your license? Do you have to do continuing education? Do you have to take an exam? What does that look like?
So after you graduate from physical therapy school, you do have to take a licensure exam. And I know people study and study. It's very rigorous. People have failed it the first time. One of the greatest therapists here at Grant failed her PT licensure exam the first time, and she's one of our best therapists. So she took it the second time, did great. So we do have to take a licensure right off. We have to take another test. It's for laws and regulations. I think it's an extra little test. It's kind of like to get your driver's permit. It's kind of like that little extra test, but you do have to know that kind of stuff. But the main is your licensure test, and then every 2 years we have to have 24 units of continuing education, and that's basically 24 hours worth of education. OhioHealth does a nice job. They offer classes for us to get online and be able to take an hour at a time. A lot of people go to a weekend class. If you go for 12 hours during the weekend, right there's 12 of your continuing education units. Some of those units, you could take a class in college that will qualify you for the continuing ed units that you need. A lot of different ways you can get it. Even being a clinical instructor for a student, you get CEUs, clinical education units for that too. So it doesn't take a lot of work for 24 hours in 2 years.
Absolutely. And then we're getting lots of really good questions coming in from Facebook, but what advice do you have for finding shadowing opportunities? And I know right now it's probably very different than what it normally looks like, but do you have any tips for our students?
Yeah, most big hospitals will allow you to shadow, and you just call the therapy departments. Everybody's different. OhioHealth, we've got one of our administrative assistants is the one that organizes all the students. So just make your calls, send your emails, and they usually will be able to find you a contact person. As far as the smaller clinics, there's private clinics. There's a private clinic in Bexley that you just call up the owner and just make the phone calls. At least these days, you probably emails, but you should be able to get some contacts, I would think, fairly easily. And like I said, if you're networking with some healthcare workers, just find a therapist that somebody knows and ask them, and they should be able to give you some contacts.
Yeah, we always kind of remind our students the worst thing they can say is no. So
Right.
it's helpful to just kind of put yourself out there and ask
Right.
for what you want. And that is going to be really helpful for them to really get a glimpse at what the work is like. So I'm hoping that our students can find some opportunities even with COVID, hopefully.
Right.
Next question was, oh, go ahead.
Right now you won't get credit for this. You can't very well put this on a resume, but maybe you can even find some stuff online, some videos, and there's a lot of good education stuff out there that maybe you can find too.
Absolutely.
You really need to get in the settings.
Yeah. But I've noticed that too is, now with YouTube and everything else, you can really get a glimpse at what some of the work is like, not as close, obviously, as shadowing in person, but if for some reason COVID has that limited right now, definitely I would recommend checking that out. Like there's we found lots of like day in the life videos and
Right.
videos of therapists explaining exercises and things like that, that can be really helpful. Let's see. Our next question was, where do most newly graduated PTs start? Is there like a particular area that they typically start in? What does that look like?
Everybody's really different. When I was newly graduated, I think the idea was to go into an acute care hospital first. But not everybody needs to do that, especially if you're interested in outpatient care. I think every setting will hire a new graduate, and it really depends on where your goals are. I think a lot of times wherever you do your clinicals, your education sites, a lot of times you meet your connections there. So when you do your classwork in physical therapy school, but then you're sent off to hospitals and nursing homes and outpatient clinics and inpatient rehab facilities, and that's where you meet a lot of people for your networking. And a lot of times, we've hired many students that we've had at OhioHealth. So we've had somebody come in and they're our student for 6 weeks, and we know how those students are, and we know if we want to hire them or not. So when you do go to your clinicals, if you're in PT school, take those seriously, and because they could be somebody that you want to apply to for a job. And it goes vice versa too. You could see if you want to work there.
Mm-hmm.
So
yeah, we had a conversation with a nurse practitioner yesterday, and she kind of said your clinicals are like the longest job interview you'll ever have.
that's true.
Oh, a student in the comments mentioned that there is a podcast called Pre-PT Grind that's offering virtual shadowing hours. I don't know what that is like, but technology is bringing career information to people in very new ways. And then someone wanted to know, is there a specific way to formally document shadowing hours? And I know different healthcare programs require shadowing hours. I know you mentioned you had to do a lot of volunteer hours. What did that look like?
A lot of times there's forms that the schools have. So when you do your shadowing, when people have shadowed me, they have a paper that I sign that they spent so much time with me. So I think a lot of it is whatever school you're applying to, you just need to have proof of it. And if you're not applying to any certain school at the time, just make sure you have good record of it. Maybe get some signatures. Have a whatever hours you've put in for the day. Just make sure you have it somewhere, so that if you need to go back to and make sure you know what therapist you spent time with. So if you need to go back, you can have that proven as you need.
Absolutely. And we're almost out of time. We have just a few more minutes, and I'm going to remind all of our students on Facebook to get in their questions in the chat if you have any last minute questions. But I know that you had mentioned volunteer hours. Was that a required part of getting into your program? And where did you do those hours specifically?
Okay. Yeah. Yes, it was. Long ago, mine was 200 hours, which is an awful lot. And lately, I've seen schools ask for different areas of volunteering too. So they want you to see so many hours. It's usually not just 200 anymore. I think it might be a little less, just because there's so many people that want to get involved. We don't have that many facilities that can provide shadowing, but it's probably less hours than that now. But they want you to do so many hours of home physical therapy, so many hours in an outpatient clinical setting, so many hours in a sports medicine, so many hours in an acute care hospital. So you might want to really look at each program that you're going to apply to and see what they require before you get involved too far into the shadowing.
Absolutely. And that has again been kind of a theme of the week, is that different schools have different admissions requirements
Right.
and what they look for. So if for our students that are considering going on to something like PT school, we talked to a medical resident earlier, and his advice was the same, was really like try to figure out what schools you're interested in and figure out what their requirements are.
Sure.
Yeah, absolutely. And let's see here. I'm pulling up kind of our last couple questions here. Someone wants to know what age groups do physical therapists work with? And it kind of sounds like it is all all of the
It
above
is.
almost.
That's actually one of the beauties of physical therapy. I mean, you may have some vision of what you want to do. We'll say you love children, you want to be a pediatric physical therapist. You can do that. You can go into school thinking that, and then you might go to a clinical where you're working with geriatrics, elderly, and you absolutely love that. A lot of people have shifted gears through their PT schooling. Once you get involved with a certain kind of patient, you may decide you want to do something else. But a physical therapist is across the board everything. You can specialize in just one part of the body. You can specialize in one. You can specialize in what maybe dry needling, which is not acupuncture, but something similar. You can specialize in incontinence. So you can be a pelvic floor therapist for people that can't hold their urine. I mean, you can do so many different things with it. You can specialize in strokes. You can specialize in traumatic head injuries. You can do lots of different things. You can work at you can work and you could be an athletic trainer, physical therapist combined, and work on that in a professional sports team. It's wide open as far as what you can do and the hours that you want to work. Even really, you can be a full-time therapist. You can be a part-time therapist. You can do a number of different things.
Yeah, and so that actually is a kind of a good point. A lot of students are curious about what does a typical schedule look like, and it sounds like there's a pretty wide variety. Are there schedules or that you think are most common?
Hospital therapists that's one of the things that's a downer in working in a hospital is you're working a lot of holidays, you're working a lot of weekends when other people aren't working, and that is frustrating. So that's one of the downers in a hospital setting job. And in an outpatient job, you work long hours because these patients or your patients coming in are working around their work schedule. So you've got to work at really early hours or really late hours. You're not working as many weekends, maybe Saturdays, but yeah, you can work all different settings and time frames. I'm losing my voice.
Yeah, absolutely. And so it sounds like there's lots of options, lots of different schedules, lots of specializations. Yeah, so we are basically at the end of our time. Is there anything else that, like, kind of any last minute advice or thoughts that you might want to share with our students who are interested in the field?
I think, I wrote down something that one of my friends said. Here's what she says. If you want to be a physical therapist, you have to really want to do the job. In the outpatient world, you tend to work long hours into the evenings frequently, which can cut into the time spent with family and friends. If you work in the hospital setting, anticipate working weekends and holidays, which is what I just said. Okay, this is very kind of intense, but she says you will massage hairy men's backs, white butts, and you will do dry kneading and lots of playing toss. I mean, it's just sometimes it's not what you expect, but here's the good part of what she wrote. If you live for serving others, if you live for being a part of a process of a journey towards recovery, if you know that you have to be more of an advocate for your patient sometimes than they are for themselves, because you know what's best for them, then this is the job for you. It's gritty, it's exhausting, it's demanding, it's draining, but it's also rewarding, uplifting, especially when you see a patient take a first step in months, encouraging when you see them cry because they can't believe that their family member has accomplished a big amount of things in a short period of time. And these are the days that you'll live for.
Yeah.
So I think that kind of sums it up. I mean, it's a great profession.
Absolutely. And I just want to say thank you so much for being here and being willing to share your work and your passion for the field with our students. And we were kind of joking before, I hope we see a lot of future physical therapists. When you look at resumes, I hope you see lots of students that started at Columbus State that are, inspired to pursue this career path. So thank you so much for giving your time today and answering all of our students' questions. I really appreciate it.
No problem. Thank you.